As a student nurse, I had a placement in theatres and I just fell in love with it. It was something that I enjoyed, I saw the challenges there, and I wanted to be part of that team. The opportunity came up for the nurses to enhance their role and become anaesthetic nurses, and so I took it. There's lots more greeting the patient, having a patient that's awake that you talk to, which you don't get so much on the surgical side. So you build that relationship with your patient. I have to admit, I do like the adrenaline rushes when your patient needs you and you're there for them.
Working as an ODP, we cover across 3 areas. So we cover recovery or post-anaesthetic care, anaesthetics and surgery. I like being able to provide the care to the patients in really quite a distressing time for them, whether that's an elective planned surgery that they're having or whether it's a clinical emergency in theatre or anywhere across the hospital.
I started as a surgical nurse in an elective theatre that was Urogynae, and during the pandemic I moved to the emergency theatres where I joined the 24/7 service, and I was mainly surgical at that point. I then did the anaesthetic nursing through Anglia Ruskin, which was funded by the trust, and that gave me a dual role in practice. So I work as an anaesthetic nurse or a surgical nurse. Ever since joining the NNN, I haven't regretted the decision. It's a big step moving to a new country, and NNN has since felt like home away from home.
I love the fact that it has its challenges. You often have to think on your feet, especially where I work in emergency theatres. The dynamics change all the time. You may have a plan for a certain type of procedure, and then all of a sudden someone will go, no, we're going to have to stop that procedure. We've got something else coming in which will be completely different, and so you have to rethink your strategy to deal with that.
Working with patients, what I really wanted to do, making sure they're comfortable before surgery. As we know, this is a very stressful time for the patient, and just being there for them and being the advocate when they can't advocate for themselves, it's what I really love about this job.
Having a strong team dynamic really motivates you to come to work and enjoy the work that you're doing. But ultimately, the patient care that we provide is of a high standard. I pride myself on giving the best care that I can give at all times. It's a fast-paced job. Things can change. You have to really think on your feet at times. It's a job where you have to preempt things, be one step ahead of the game. The anaesthetist might require a piece of equipment, or the surgeon might require some equipment, and it's sort of for you to then adapt to the changing environment that's happening around you and make sure that you've got the equipment and the knowledge to know what's happening and how to respond.
During COVID, we had complex airway cases, obviously due to the pandemic and the symptoms, and I felt inspired by anaesthetic nurses and ODPs in the department to sort of help with airway emergencies and help our patient group with the anaesthetic environment. So that came as interesting, exciting and challenging, and also in building my career progression and development, I felt that was a good opportunity to take on.